Aloha and welcome to the John A. Burns School of Medicine, ʻOhana. We are so happy to welcome the friends and family of the JABSOM class of 2025. We would like to introduce you to the JABSOM Office of Medical Education that will be an integral part of your students' educational journey. The Office of Medical Education oversees the curriculum for the students throughout medical school and runs all of the required courses for their first 2 years. As a part of this, we evaluate all of the educational programs on a regular basis to ensure quality for our students and to make sure that we listen and respond to their feedback. We oversee the Clinical Skills Program and the Center for Clinical Skills, where your student will be able to practice their communication and physical exam skills on standardized patients. Our office is also responsible for much of the faculty development for the medical school and provides both pipeline programs for high school and college students, as well as international training opportunities for faculty and students from Japan and other parts of Asia. There are 7 main graduation objectives that your students must meet to graduate from JABSOM. Our graduates will be lifelong learners. They will understand the biological sciences underlying clinical medicine. They will be able to care for their patients with increasing responsibility under faculty supervision and respond to feedback. They will be able to communicate effectively with patients, families, and other healthcare providers. They will appreciate the epidemiology of disease and the role of the physician in public health and global health issues, particularly those important to Hawaii and the Asia-Pacific region. They will be professional and ethical and demonstrate an enthusiasm for medicine while delivering compassionate care to their patients. And lastly, they will have the skills and strategies to maintain personal health and well-being. This is a bird's-eye view of the curriculum for the 4 years at JABSOM. In the first 2 years, students will go through curricular units designed primarily around organ systems. The 3rd and 4th years are known as the clinical years, and the students will be working in hospitals and outpatient clinics to learn the core clinical disciplines and will also have time in their 4th year to explore other specialties as well. A typical week in the first year includes PBL tutorials twice a week, lectures twice a week, anatomy, learning community activities, community health, clinical skills, and starting in MD2, students may take electives if they choose to. The primary instructional method we use at JABSOM is problem-based learning, or PBL. The students are placed into small groups of 5 to 6 students and 1 faculty tutor. These groups meet for 3 hours twice a week and utilize patient cases to learn about biological sciences, clinical medicine, as well as populational and behavioral health issues. PBL is the core instructional method and is supplemented by other activities such as lectures and labs that cover a wide range of the biological sciences, clinical correlations, patient panels, and more. In clinical skills, the students learn about communicating with patients and taking histories, how to examine patients, and get a chance to practice these skills on both standardized patients as well as real patients in the community. In the first year, students participate in a year-long community health program. There are 10 different programs that your student can choose from, ranging from helping to mentor high school children, working with the homeless or families of seriously ill children, learning about Native Hawaiian health, or working with mental health and geriatric patients. A relatively new addition to the JABSOM curriculum is our Learning Communities program. In learning communities, the students are placed in small groups that are led by a faculty mentor that they will stay with for their entire 4 years. These mentors help guide their groups through a number of different discussions and activities and also serve as their academic advisors. The learning communities provide more individualized clinical skills training and observation and also enable us to focus on topics that are usually more difficult to address in large group settings, including health system science, wellness, cultural issues, ethics, and professionalism. Your students are going to have to study very hard during medical school, much more than they had to during high school and their undergraduate years. It takes a lot of dedication to become a physician, and your students will be putting in long hours reading and studying, both at home, at school, and anywhere that can help them to focus. The students are welcome to study at school, and the building remains open for them until midnight daily. Parents and loved ones often ask what they can do to help, and one of the easiest ways is to just have an understanding that your student is working really hard and may not have as much time to spend with you as before, and just be there to be a friendly ear when they need one. I hope you have a better understanding of the curriculum here at JABSOM and what the Office of Medical Education has to offer. Please know that we are always here for your students and that we will do all that we can to help them to succeed and become the best physicians possible. Congratulations again to the JABSOM class of 2025.